Many patients ask us, doctor, why are you suggesting us less number of grafts as compared to the other clinics? Now this is a common observation that I hear, that XYZ clinic has suggested us 5,000 to 6,000 grafts in one go. They will cover the full head and no need for any further sessions and all that. And especially even in smaller areas where you have grade 3 baldness, people say that they have been suggested 5,000, 6,000 grafts, but why are you telling us lesser number of grafts, 2,000, 2,500? So there are 5 important points that you should keep in mind. Number 1, at AK clinics, we scientifically plan the requirement of grafts in the recipient area. We measure the area, we put it on a tracing paper, we see how many centimeters square of area is there, and then in order to give a natural look or a naturally dense look, you need at least 40 grafts per centimeter square. Now, just for your reference, the total surface area of the recipient area is 250 to 300 centimeters square. Now, that is going to be a total of 10 to 12,000 grafts. As you have seen in my previous videos, do you even think you have 10 to 12,000 grafts? So how do you give a density of 40 grafts per centimeter square? You have to take other points into consideration. And when it is a smaller surface area, at that time we can still give 40 grafts per centimeter square at the front as per the requirement. But as we keep on going backward, the grafts have to be decreased because you do not have that many grafts. Number 2, the most important point is not only what is absolutely required, it is how many can be taken out from the donor area. As demonstrated in my previous videos, we can take out hardly 4,500 to 5,000 grafts from the whole scalp, and if I try to take out the whole in one go, it might lead to even over harvesting. Now, the people who say that give us 5,000, 6,000 in one go are not taking into account that the donor area will look thinned out as shown in this picture. If you are not concerned about the thinning, then of course you can go for a higher number of grafts. Number 3, we take into account the progression of hair loss. How many more hair grafts might be required in the future? It's not only today. What you are not able to foresee is if I place all the 5,000, 6,000 grafts in a small area, then when more baldness will happen 5, 10, 15, 20 years down the line, what will we do? So progression of hair loss has to be taken into account when we do the graft calculation. Point number 4, how many of the transplanted hair will come back? With our atraumatic method of implantation, around 90% or 85 to 90% of our transplanted hair come back. How can you compare it with a clinic where hardly 50% of the hair are coming back? They are bound to jack up the numbers just to make sure that they do get an equal amount of result. And even when we take out the grafts from the donor area, we do not count the grafts which are cut. We only count the grafts which have a propensity या जो grow कर सकते हैं. We are not counting every graft which is. Most of the clinics are just using the punching machine, and when they punch, they will count it as one graft. But does that graft even come out? No. Sometimes there are missed grafts, sometimes there are cut grafts. So we do not count any number like that. Number 3, we give the exact number of grafts by counting. Now when you count, and I know that I cannot give, but are the other people even counting how many grafts are there? Literally, are they counting or just giving you a number on the basis of that, okay, एक बार में 5,000 निकल जाएंगे तो इस तरह. So this is what you have to take into account. Number 5, every patient who is being operated outside, not every, I would say most of the patients who are being operated outside, even if it is a small area, they are told 5,000 to 6,000. Now how is it possible that every patient needs 5,000 to 6,000 grafts? Look at these pictures. We have given somewhere 1,200, somewhere 1,400, somewhere 2,000, somewhere 3,500, just to make sure that the treatment plan is customized. Now, I would like to sum it up by saying that it is not only the absolute requirement of grafts. It is how many do you have a total kitty or a total pool, which is 6,000 to 7,000 grafts in a life. Now, how do you plan it for the entire life and not just today? Because the ongoing hair loss will trouble you even in future. So you should have a long-term plan. Try to find out the relative requirement of grafts rather than just going for a higher number of grafts with less survival rates. Thank you.